Good morning, everyone, and welcome to County Executive Pittman's virtual press conference. This morning, the County Executive will share updates on the county's response to COVID, on national recognition for county agency performance, and on our senior activity centers. We'll take questions after, so as a reminder, please put your name and media affiliation in the chat, and I'll call on folks for questions in that order. And with that, Mr. County Executive.
Thanks, Jeff. Thanks, everybody, for joining us. I guess good news on COVID, which is that we have gotten below the magical 5 cases per 100,000 that we were below last summer, continuing to drop in our case rate. And in addition to that, on vaccinations, if you look at only adults in the county, we're actually at 67% vaccinated, which is that 80 and 90% that we're striving for. At least 80 is within sight. But then, of course, we have ages 12 and up, 12 to 18 as well, that we need to get vaccinated and add to those numbers. One of the things that I've talked about a lot is that this has been proven to be a seasonal virus, and that what we really need to be doing is preparing ourselves to prevent a fall surge. And one of the tools that I think businesses need, and I know Anne Arundel County needs, is an efficient way to know who's been vaccinated. So people have vaccine cards that they get when they've been vaccinated that they can show. But county is going to start today heavily promoting the use of not an app. We looked into that as a vaccine passport, it's often called, but in fact, using the existing state immunization record website, which is very simple to use. I did it myself. It's md.myir. So it's my immunization record, myir.net. And I went on, and it took me probably about 2 minutes to get my own COVID vaccination record, which then is a PDF that I keep on my phone. And if I am asked to show proof of vaccination, I can now do so. For county buildings, there's my vaccination record. I got the Johnson & Johnson, so I only had to do 1 dose, shot, 1 jab, as they call it, over on the other side of the pond. But for county employees, what we have said is that if you're vaccinated, you do not need to wear a mask indoors at work. But if you are not vaccinated, you still should. And this is the CDC guidance as well. And so the question's been asked, well, how do you know? How can you enforce such a thing? Well, it's much simpler to do with this app. So we're going to be encouraging businesses to do the same if they want to have similar policies, and make sure that everybody who's gotten vaccinated and gets vaccinated knows how to download their vaccination certificate. They call it. Actually, what I will do is let me pass it over to Dr. Kalyanaraman for some further comments on the state of the pandemic and vaccinations, and then we'll come back and I want to talk about a couple of other things that are going on. So, Dr. K.
Thank you, County Executive. So as County Executive noted, we are down below 5 cases per 100,000, which is fantastic. Just the continued positive benefits of both vaccination and heading into the summer months. And I think what's really critical is that we recognize that because this is seasonal, we don't want to let our guards down over the summer in terms of letting virus circulate, or particularly not getting vaccinated. We're going to continue pushing on the vaccinations. We do have 67% of adults who've gotten at least 1 dose, and we want to hit. We'd love to get to 90%. Our goal is to at least get to 80%, and we're going to be pushing really hard over the summer to do that. We're seeing the demand in the 12 to 17-year-olds. Our school clinics last week had just short of 1,500 students who got vaccinated at the 4 high schools. We've got another 4 coming up tomorrow, and we've got, because of the high demand, we've got over 1,700 appointments scheduled, which is fantastic. Right now, it's about 27% of kids 12 to 17 have gotten at least 1 dose. And that's good. We're just going to keep pushing, right? That was only approved a few weeks ago. And we're going to keep pushing on that number particularly. On that front, we're working with pediatric practices and we're transferring doses to them so that they can get vaccinations into the kids in their practices. We've been very committed to making sure that people can get vaccinated in as many places as possible. So libraries are a key part of that strategy as well. We are also seeing that our hospitalizations are coming down, continue to come down, which is fantastic. We are under 30 people hospitalized right now across our 2 hospitals, which is a really good thing to see. And this is what the vaccines do. There's been a lot of hype and talk about the fact that, oh, some people got COVID after the vaccine. That's fine as long as they stay out of the hospital to stay away from the severe symptoms. That's what the vaccination does. Keeps the severe consequences from occurring. Our community ambassador program is underway and in full force. They're in neighborhoods throughout the county, from Annapolis to Lothian, Glen Burnie, Severn, Odenton. I'm not going to name them all, but they are everywhere. They'll be recognizable by the shirts that they're wearing. They have communication materials, postcards, door hangers, videos. It's worth a shot, and can organize transportation to get folks vaccinated. That's going to be a key part of our strategy going forward. And we're seeing that this is something that communities are really excited about, and having folks who are from community organizations in their communities doing this work. As the county executive noted, the Immunet record is really easy. It took him 2 minutes. It took me 4 minutes to do me and my 2 kids. It's super simple, and you get your vaccination record. It's your digital vaccination record, and you can carry it around with you on your phone, put it on your computer, print it out, do whatever you need to do with it. And it's, even more importantly, it's free, and it takes virtually no time. The last thing that I want to note is that it is Mental Health Month, and one of the things that we're really focused on, especially as we start to relax from the throes of the worst months of the pandemic, is that as people start to relax, a lot of the things that we had bottled up, that we kind of just had to push out of the way so that we push forward, start to come back in. So if you do need somebody to talk to, or you do need any help, please reach out to our COVID warm line. To our mental health warm line, apologies. That's what they're there for. They've been there since before the pandemic for years, and they are still there for people to access. With that, I will turn it back over to you, Kenny. Thank you.
Mr. Executive, you're muted.
I was muted because the Blue Angels are practicing overhead, and it's really loud, and I'm looking forward to being done with this call so I can go up on the roof and see them. But I spent a fair amount of time bragging about the amazing work that a lot of our departments do in county government. I'm a huge fan of government's role in solving problems, and I celebrate that often. But it's really great when it's recognized nationally with awards for the work that Anne Arundel County departments are doing. So we are putting out a press release. It may have gone out. It will be out very soon, about 3 awards, really. There are 2 from the National Association of Counties that will be meeting in Prince George's County this year for their national award ceremony, and we will look forward to receiving these awards. One is to the Department of Aging and Disabilities, but really it should go to all county health and human service agencies for the work that they've done with the food access and warm line. First, it started with the maps of our food distribution centers and a lot of the expansion of that, and then the promotion of that, and then the warm line, which has taken 19,000 calls for things like eviction prevention, mental health counseling, vaccine appointments, and just about anything that people have needed during the pandemic. And so that was a great one to hear about. And then the other from NACO is the Preserve at Eisenhower Golf Course. And they received an award, not just because it's a great golf course, but the work that DPW Watershed Protection and Restoration Bureau did with the stream restoration and wetland creation and enhancement at the golf course, and the way they made that an environmentally positive feature. So we're very proud of them. And then the National Association of Clean Water Agencies has once again recognized our Department of Public Works Bureau of Utility Operations. All 7 of our facilities got awards, 3 platinum, 3 gold, and 1 silver. And so that's something that most years we get some awards, but we did really well this year. So we have Chris Phipps here to answer questions if you have them from DPW. We have Carissa Gowan from Aging and Disabilities as well to answer questions. And we also have Rec and Parks here if you have questions on any of those. And then finally, I just want to mention that our senior centers, and Carissa is here to talk about this as well, will be starting on June 2nd, doing some outdoor programming at our 4 closed centers that have not yet opened. We'll have no pre-registration for the hours at the open centers that in the mornings and the afternoons where there's been pre-registration. And then as of June 28th, our childcare that's in our senior centers will have moved on, and all of our senior centers will finally be open, which is something that's been a long time coming, and we feel great about doing. So back to you, Jeff.
All right, thank you. So we're going to open it up to questions. First up, Amy Simpson from Fox 45.
Hi, good morning. Can you hear me?
Can you hear me? Got you, Amy.
Okay,
Yes.
Great. Sometimes I'm on mute on my end. So, Mr. County Executive, it's expected to be a busy summer for the Eastern Shore for travelers as people feel more comfortable venturing out, they get vaccinated. And if what we saw this past weekend with the Bay Bridge is any indication, it will be a challenging weekend to get both directions on the Bay Bridge. So I'm wondering what's being done right now on the Anne Arundel County side to mitigate bridge traffic as we head into what's expected to be a busy summer.
Well, there's not much we can do except that some of the neighborhoods that people try to go through when they get on Route 50, get close to the bridge going eastbound, we communicate with Waze and the apps to let them know that those streets are not open for outside folks, but it's an ongoing problem. This is, I guess, the second year and the first one where we didn't have the pandemic slowing things down, in which the all electric tolling has been in place. It's something we advocated for and got done. So that moves the traffic better than when we had the tolls that everybody had to stop at when they're going eastbound. We've been pretty vocal with the state about exploring other variable tolling as well to help with the traffic, but there's not much we can do beyond that.
Which plan of the corridor project are you supporting at this time, and how are you involved in the ongoing discussions of this next phase?
Well, we commented on the proposal that the Route 50 corridor be the one that they build a third span at, and we discouraged them from doing that. We noted that they did not make a plan for the corridor. They only made a plan to study an actual bridge crossing. And we know that it's that Route 50 corridor where the problems lie. So that it would need to be a much more comprehensive approach. But that if they want to build a span elsewhere that does not attract more traffic to our thoroughfare, that's fine. It's going to be very expensive, but we don't think that a third span is the answer. And the traffic, we have traffic problems all over the state, and public transportation needs. And $7 to $9 billion for a bridge that would be done in about a decade. We need to be looking at other options for transportation in the future, and that's where we think the focus should be.
Thank you, sir.
Next up, we've got Danielle Ohl from the Capitol.
Hey, good morning. Mr. County Executive, I wanted to clarify on the, like the vaccine kind of identification that you mentioned. Is that going to be required for employees that are working in county buildings or even visitors to county buildings?
It's required that people wear masks if they are not vaccinated for our employees in our buildings. And so the question has come up, well, how can, what do you do if somebody is, maybe on the one hand told their friends they're not vaccinated, but on the other hand, telling their boss that they are, and they're going around without a mask and hearing complaints. What do you do? Can you ask people? And the answer, the law office says, yes, you can ask people if they've been vaccinated. And the way that they can prove it easily is with this app. So it's just a convenience system for people to be able to prove that they're vaccinated in situations like that.
Gotcha. So
not required to get vaccinated, but you do have to wear a mask indoors working when you're among others if you're not.
Okay. And if you're like a member of the public that's visiting a county building, I know most of them are still closed to members of the public, but will you have to show vaccination as well in order to be unmasked?
To be unmasked. Right now for senior centers, for instance, you have to be masked. So they're being very, very careful at this point, but we are looking at that question as we open buildings that have not been open. And for senior centers and libraries they have that same question to look at. No decisions have been made yet whether we're gonna follow the same policy as employees.
Okay. And then last thing really quickly, for the county health officer, has the county seen an increase in vaccine appointments or walk-ups since the lottery announcement was made?
Dr. K, that's for you.
All right, I was just unmuting myself. We've seen a little bit of an increase in appointments, but not a huge one. But it's definitely helping. I will tell you that. We talked about 3 or 4 weeks ago, we were 100%. We dropped down to close to like 10 to 15% of our appointments, and we're probably up to about 25 to 30%. So it is helping.
Okay, thank you.
All right, next up, Rob Lang, WBAL Radio.
Hi, good morning. To either Dr. K or the county executive, what concerns, if any, do you have this week, commissioning week, COVID related? That's, the restrictions are down. Although I know there's a capacity restriction at Navy Marine Corps Stadium, although I'm not sure what it is. Somebody may be able to fill me in on that. But is there a concern that this week, with all the visitors coming in, things might go backwards when we talk again next week regarding COVID?
Well, Dr. K can answer if he likes. I'm not particularly concerned because it seems like this downward trajectory has been so solid, and it follows what the models predicted. Some of it has to do with summer. But we do continue to encourage people to follow CDC guidelines, which say wear a mask if you're not vaccinated when you're among others in indoor and crowded outdoor spaces.
And I'd echo that. I'm not concerned any more than I am for other events. And I will say that the Naval Academy and its people who are associated with it are doing a really good job of adhering to those guidelines, getting vaccinated and masking. So if there's a group that I think is probably going to do the right thing, it's that group.
Okay, thank you very much.
All right, I don't see any other questions in the chat. I'm going to do one last call for any questions from press. All right, seeing none, we'll wrap it up. Thanks everyone and have a good Tuesday.